First, I'd like to talk about traditional knee replacement. So for many years, we performed knee replacement surgery, which involves replacing all the surfaces of the knee and placing a metal cap on the end of the femur, a metal tray on top of the tibia, and a polyethylene spacer between the two. And that's worked well for many years using traditional methods. The way we do this is we line the knee replacement up with the rest of the lower limb using metal rods that we either insert inside the bones or place on the outside of the bones. And we use these to work out the best alignment. Now, unfortunately, no human being can work out the best alignment of these through 3 dimensions in a full range of movement. And that's where the robot comes in. With this technology, we can plan preoperatively the optimum positioning of a knee replacement for the patient, but we can also tweak it intraoperatively. We can get feedback on tissue laxity and the ligaments around the knee, and we can use this to align the knee in the way that feels most natural for the patients. So I think anybody who is a candidate for knee replacement surgery is an ideal candidate for robotic knee replacement surgery. It's unfortunately it's not offered in many centres, but I think it's well worth discussing with your surgeon if you think you'd like to consider it. Really, what we see is with robotic knee surgery is patients seem to progress very quickly. They tend to mobilise early and regain a good range of movement much quicker than we'd previously seen. So anybody who wants to get over the surgery and move on with their lives with a range of movements, with mobility, with hopefully mobilising without crutches, I think it's an option that's worth discussing. So really anybody is suitable for robotic knee replacement surgery. From the patient point of view, there's not much difference with the surgery. It possibly adds about an extra 10 minutes to the length of the surgery. The length of the wound itself is slightly shorter normally with robotic knee surgery, but we do require 2 small incisions over the femur and the tibia where we place metal probes for the robot, but nobody is unsuitable for this surgery. So what we're seeing is the recovery time seems to be quite a bit shorter in patients who've undergone robotic surgery. The reason I feel is because most patients come to me and tell me that it feels a much more natural knee and it moves very smoothly, and people regain range of movement and regain mobility and are able to mobilize off crutches much sooner than we previously saw, which is normally within 4 to 6 weeks, people are returning to their normal activities much more comfortably than they were previously.